Fall is here with pumpkins and cooler temperatures, but it also brings respiratory illnesses like colds, RSV, COVID, and those pesky allergies. How do you know what you have and what you should do to actually feel better? Nurse practitioner Jolene Kennedy was with Cone Health Chrisman Family Practice. She's here to answer those questions and is here to help you stay healthy and fit. It looks like we're having a little bit of difficulty here, so I'm going to change this camera back to the right thing here. There we go. Now we've got you up here. How would someone know if their symptoms are from the common cold or the RSV or COVID?
So that gets a little bit tricky. So for all of them, symptoms tend to come on gradually, so slowly. With COVID and RSV, you may see a fever of 100 or greater, but this isn't usually present with a common cold. So you may get a low-grade fever of 99, like 100 or less than 100, but you're not going to get those above 100 fevers. All of them can present with a runny or stuffy nose, sore throat, headache, body aches, cough, and fatigue. With RSV, you may see a high-pitched whistle sound that we call wheezing, and that can present with breathing. And this isn't usually present with a common cold or COVID, unless a person has some underlying lung disease. And then with COVID, you may see nausea, diarrhea, vomiting, loss of taste or smell, and this often distinguishes it from RSV and a common cold. Some of the recent variants we've seen, like a razor-sharp sore throat, and really to get the full diagnosis, testing is a good idea.
So it's no longer that if you lost your taste buds, you have COVID.
Not always, no, not always. Not everybody has that.
Okay, what about those fall allergies? How do you know if that's the issue?
So fall allergies and viral illnesses can have similar symptoms. However, there are some features that distinguish them between each other. So with fall allergies, you can have those itchy, watery eyes, a scratchy throat. There's not going to be a fever, sneezing, and that runny nose. So you're not going to get that fever, body aches, or that really bad increase in fatigue that you might get with a common cold, RSV, COVID. And also allergies present if there's exposure to a trigger and they last a while. So you're thinking about pollen allergies, whereas viral illnesses often resolve in 1 to 2 weeks. So if something's going on longer than 1 to 2 weeks, you often can look more towards allergies.
Okay, so you talked about 1 to 2 weeks as allergies, but what's the time frame really for like the flu? How fast can that impact us?
So viral illnesses really are often more than 1 to 2 weeks. The allergies are usually going to last a little bit longer. So your flu, COVID, those are the ones that are usually going to be limited to 1 to 2 weeks.
If we have that, what do we do to manage the symptoms at home?
So common cold, usually, symptoms are often mild, they're self-limited. So you really want to focus on rest, increasing your fluid, and use of over-the-counter cold medications, which are safe for your age group and don't interact with your other medications that you're taking. And you may want to talk to the pharmacist in regard to what would be safe to use. I'm an adult geriatric nurse practitioner, so I'm big on teaching my patients, if you're diabetic or have high blood pressure, just making sure you're taking medicines that aren't going to increase your blood sugar or increase your blood pressure. And that's when you can ask your pharmacist. They're a valuable resource. COVID, you want to kind of ensure that you're isolating and distancing while symptoms are present. And there's no real specific guidelines on that, but I do tell my patients, while they're symptomatic, try to isolate from other people. And again, you can use over-the-counter cough suppressants, fever reducers, monitor your symptoms carefully, and then seek medical attention if you start to have breathing difficulties, such as shortness of breath. There are also treatments that we can use for COVID. One of them is called Paxlovid, but you have to start it within 5 days of symptoms, and you'll need a prescription for it.
Okay.
RSV, similar to common cold, just regular treatment over the counter. And again, if worsening symptoms, you go to get seen. And then allergies, just over the counter, antihistamines, nasal sprays. If you're over 65, try to avoid Benadryl.
So you told us when to go get seen, but do you always have to go in, or could you do like a virtual visit? Does that help too?
Yes, so definitely, if you want to be treated, say that you're concerned that you have flu or COVID, you're going to want to get testing. And so in that scenario, a virtual visit may not be beneficial. You may want to go into the urgent care setting or into your primary care office. If you're just more concerned about a common cold, or if you're not interested in pursuing some of the treatments for COVID or flu, then a virtual visit's a great option, especially if you have mild symptoms. If you have more moderate symptoms, then you may want to consider going to urgent care setting and getting seen. Or if you're higher risk, you may want that face-to-face visit. So if you're more having chest pain, shortness of breath, or if you've got a really high fever, that's when you may want to seek care more in that emergent setting.
Well, thank you so much. We appreciate all the information so far. So that's what to do if you get sick. We're going to talk about how to stay healthy on the next side of this break. Stick with us.